Hi, I'm a level 1 student nurse. I was wondering if I could get an SBAR report on your patient, please.
Sure. Her name is Shanann O'Connor, room 231. She's 34 years old, weighs 177 pounds, allergic to trimethoprim sulfamethoxazole. She breaks out in a rash. She's exposed to it. She's a full code. She's been admitted by Dr. Engelbert. Her primary diagnosis is fever of an unknown origin. She has diabetes mellitus type 1 and end-stage renal disease. She's presented to the ER today at 5:30 with fever, chills, and general malaise. The patient reports elevated blood glucose readings and decreased appetite for the past few days and minimal urine output for the last month. The patient has history of renal failure secondary to diabetic neuropathy and hypertensive nephrosclerosis. She has an AV graft surgically created on her left forearm 11 months ago with no complications. She's been undergoing scheduled hemodialysis 3 times per week for about 1 year. Listed for a transplant 6 months ago. The doctor has ordered IV imipenem cilastatin to begin immediately after dialysis. Her last set of vital signs were 100.9 for the temperature. Blood pressure was 138/78. Heart rate was 108. Respirations were 20. The O2 sat was 97 on room air. And her last blood glucose reading was 210 at 5:45. Her skin is warm and intact. She has a mild diaphoresis. No lesions noted. Functioning AV graft appears clean, pink, and intact. Bruit and thrill present. Nail beds are pink with capillary refill less than 4 seconds. The patient is alert and oriented. Her last pain was 4 on a scale of 0 to 10. She has numbness and tingling in her lower legs. She's tachycardic, the regular rhythm S1 and S2. She has a slight 1+ non-pitting edema in her lower extremities. Her femoral pulses 2+ bilaterally and 1+ pedal pulses in both feet. The chest expansion is symmetric. Bowel sounds are present in all 4 quads. The abdomen is soft, round, and non-tender. There's no visible masses and no organomegaly. She's been admitted to the medical surgical unit. The urine and blood cultures are ordered to rule out the bacteremia or UTI. She has dialysis today per regular patient schedule. She's on IV antibiotic therapy.
Can I ask you a couple more questions?
Sure.
Why specifically is the client receiving this medication?
This client is receiving this medication to combat any sort of infection she may have that is causing her to have the fever. Until we can rule out what exactly is causing her fever, this is a broad spectrum antibiotic that will work to kill several types of bacteria.
Okay, what action does the medication have on the body?
So imipenem in the body binds to the bacterial cell wall and it causes the cell death. Cilastatin prevents the breakdown of both drugs in the kidneys.
When should you question administering this medication?
I would question administering this medication if the patient's creatinine clearance is less than 70 or if the patient has had reactions with penicillin or cephalosporins in the past. She does have renal failure, so we want to monitor her kidney function tests real closely.
Does this medication have a therapeutic serum level?
Yes, usually between 5 and 10. We measure the peak plasma level 30 minutes after the dose, and we measure the trough 30 minutes before the next dose.
Which vital signs must be monitored?
So all vital signs are important to monitor, but we want to keep an eye on the client's temperature to see if it is coming down.
Which physiological parameters should be monitored when the medication is being administered?
We want to monitor the client's overall appearance because an adverse effect is seizures. And we also monitor the clients for signs of anaphylactic reaction like a rash or laryngeal edema, wheezing.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
So in the hospital, it's important to teach the patient about their medication, why they're taking it, and the side effects of it, the adverse reactions, and it also teach them about the IV patency and what signs to look for if it becomes infiltrated. And I would just let them be aware of the signs and the side effects. So she would let me know if she feels uncomfortable in any way.
What interventions must be taught for taking the medication safely at home?
The client will most likely not be taking this medication at home just because it's an IV piggyback. You might have to take a different form or dose, but I would enforce the same teaching about the side effects and the adverse reactions.
What are the side effects and potential adverse reactions?
Okay, so the side effects, we have diarrhea, nausea, vomiting, rash, and the adverse reactions can be C. diff, seizures, and anaphylactic reaction.
How will you know the medication was effective?
We will know if the medication is effective when her fever has gone down and her cultures come back negative.
Okay, thank you.
All right, about to administer medications. Hi, my name is Naz. I'm going to be your nurse today.
Hi,
Can I get your name and date of birth?
Shanna O'Connor, 34.
Okay, do you have any allergies?
I do sulfatrimoxifene.
All right, and we're going to double check that in the chart. So we have Shannon O'Connor, 34, and trimethoprim for allergies. All right, so you are due for sodium chloride and your antibiotic. Do you know why you're receiving the antibiotic?
Yeah, because I have an infection.
Okay, do you know the side effects and the adverse reactions?
Not really.
Okay, so side effects can be nausea, vomiting, rash, or diarrhea, and adverse reactions can be seizures or anaphylaxis or C. diff. So if you experience any of these, let me know, okay?
Okay.
All right, gonna wash my hands. Pull out gloves. Okay, so first thing I'm going to do is I'm going to pull out the medications from the storage room. So we have the 0.9 sodium chloride, 500 milliliters, and we also have the imipenem 500 milligram. Okay. I'm going to check them for any leaks and check the clarity and the expiration date, which is November 2019, which is good. I'm going to check the other one too. Clarity, leakage, and the expiration date is February 2019. That's good too. Now I'm going to compare them to the chart to compare them to the doctor's order, and then I'm going to compare them to the MAR. Okay, so we have 0.9 sodium chloride, 500 milliliters, and the rate is going to be 30 milliliters an hour. It's continuous, and the route is going to be via IV, and your IV is on your left hand, so that's where it's going to be. And time is going to be 6:30, which is now. Okay. All right, I'm going to prepare the first one. I'm going to get the primary tubing. I'm going to clamp it. Okay, it's already clamped. Alright, and then I'm going to spike it. Spike.
and going to prime it. Okay, so I'm gonna just loosen up cap a little bit, unclamp it. All right. It's primed now. Okay. All right. I'm just gonna hang it. Now I'm gonna do my medication checks before I administer it. So again, can you give me your name and age and allergies?
Shanna O'Connor, 34, sulfa trimexoprim.
Okay, I'm gonna double check that in the chart. Okay, Shanna O'Connor. Okay, can you give me the ID on your bracelet?
Sure. 842 334 3660.
Okay, then I'm just gonna scan the medication barcode. Okay, so we have the green light, which means we have the right patient and the right medication. Again, I'm gonna double check the medication. So it's sodium chloride, 500 milliliters at 30 milliliters an hour. So right there, and it's via IV continuous, 30 milliliters an hour, and the time 6:30, which is right now. And IV site is gonna be her left hand. Okay. All right. So since we don't have the pump, I'm just gonna connect it to the dial flow, which is right here. Okay. So just gonna scrub the hub. Then I'm gonna prime it again with using the dial flow. So we want to put it on prime and drip. Okay, that's good. And I'm just gonna check the IV site to make sure there's no infiltration. Okay, so does it hurt?
No.
Okay, so the IV site is dry, clean, and intact. All right, I'm gonna just flush it. Make sure it's patent. Okay, it's flushing, so we're good.
adjust the flow rate to 30 mLs an hour. Do you want to verify?
Yep.
Okay. All right, so now we'll open the clamp and let it run. Okay, I'm just gonna sign it and initial it and put in the side of the IV, which is the right hand, and the time, just 6:30, and the rate is 30 miles an hour, and the teaching method, we're going to use the teach back method, and I'm going to sign it. Okay. All right. Okay, so I'm going to prepare the second medication now, which is the imipenem. Okay, so we have the imipenem. Just going to double check it and compare it against the MAR. So it's IV piggyback, and according to the pharmacy drug guide, it can be administered with via piggyback with the sodium chloride. And the plan to monitor the desired effect, so we're going to keep taking her temperature every 2 hours just to keep a track of if it's increasing or decreasing. Okay, so we have the 500 milligram imipenem. It's going to be IV piggyback. It's going to be on the right hand, and the rate is going to be 100 milliliters an hour, and it's going to be every 8 hours, and the time is 7:30. Okay, so we can go ahead and administer it. All right, can I get your name and age again?
Shannon O'Connor, 34.
Okay, and do you have any allergies?
I do. Sulfa.
Okay. Put that in the chart again. Shannon O'Connor, 34, trimethoprim allergy. All right, can you give me your ID again?
842-334-3660.
Okay, and I'm gonna just get the medication code from here. Okay, so we have the green light again. You want to double check it? Okay. All right, I'm gonna prepare it. Okay. I'm just gonna spike it and make sure this clamp is closed, which it is. All right, and then gonna fill it halfway and prime it. All right. Just gonna close with the clamp again. Okay. All right, I'm gonna do my last med check before I administer my medication. Okay, let's close. All right, so give me your name and
Okay, and your allergies?
Trimethoprim sulfa.
Okay, all right. And we have here 500 milligrams of imipenem, IV, and 500 milligrams of imipenem. It's going to be IV piggyback. 30 milliliters an hour. It's going to be in your left hand again. And as we checked before, the IV site is clean, dry, and intact, so it is safe to administer the medication via the IV route. And the time is 7:30, so we can go ahead and administer it. Alright, so we're just going to connect it to the primary line. So we're just going to scrub the nearest one, and we're just going to connect it and unclamp, and we need to adjust the rate of flow. So it's going to be 100 milliliters an hour. You want to double check that? Looks good. Okay. So now we can unclamp it and let it drip 5 times. And that's it. We're all set. How are you feeling?
Good.
Can you tell me the side effects and the adverse reactions that I've taught you earlier?
Side effects are nausea, vomiting, diarrhea, and the adverse effects are seizures, anaphylaxis, and C. diff.
Very good. So if you experience any of these, you let me know right away. And there's your call night, okay?
Thank you.
All right, I am gonna sign for the medication administration. So I'm gonna put the site, which is the left hand, and I'm gonna put the time, which is 7:30, and the rate is gonna be 100 milliliters an hour, and the teaching method we use is teach back. And I'm just gonna sign it. And there's no other assessment that needs to be documented at this moment. And like I said, we're gonna keep monitoring her vital signs and closely, especially her temperature, to see if it's going down. And yeah, do you have any more questions for me?
Yes. Were there any pertinent pieces of information you reviewed before administering the client this medication?
Yes. I reviewed the patient's allergies to make sure that they're not allergic to the medication. I also have to make sure that it's the right patient and the right dose and the right routes and the right time. And yep, all of that.
Did this information affect your decision to administer the medication?
Absolutely, because if the patient was allergic to had allergies to penicillin or cephalosporins, I would have called the doctor and notified him immediately to change the medication per the patient preference and allergies.
Did this information affect how you administered the medication?
Yes, I had to check the patient's IV and flush it and make sure it's still patent and it wasn't infiltrated or
And I had to also check on the patient, their overall appearance, and see if they were having any signs or side effects of the medication. And yeah, that's pretty much it.
Okay, those are all my questions.
All right. Well, I'm gonna finish my documenting. Thank you.
Thanks.